Hello friends and welcome to our channel RN Online Tutorials. Today we are going to learn about physiology of arterial blood pressure or in simple words blood pressure. So let's see what we are going to cover today. Various definitions, the determinants of the blood pressure, factors affecting blood pressure and the short term regulation of the blood pressure, that is barroreceptor mechanism, and long term regulation of the blood pressure, that is renin angiotensin aldosterone mechanism. So let's start. So first we will start with the definition. So arterial blood pressure is defined as the lateral pressure exerted by the column of the blood on the wall of the arteries. The pressure is exerted when blood flows through the artery. So this is very important to keep this word in the definition. Without these words, lateral pressure exerted by the column of the blood and the when blood flows through the artery, the definition is incomplete. Otherwise, the most students telling the definition is arterial blood pressure is defined as a pressure exerted by the blood into the walls of the artery. So that is incomplete definition. Without these words, the definition is incomplete. Why? Because if you will see, the pressure through the artery is round in the shape and blood is flowing like this. So it is exerting pressure on all the sides, on the forward, backward, lateral sides of the wall, everywhere it is putting the pressure. But we are considering only the lateral pressure as the blood pressure, and also if you will see, it is flowing blood. So when the blood is stopped, there is still the pressure, but it cannot be recorded because there is no pressure because of the blood is not flowing. So if you will see, in dead person, the blood flow is not there. So because of that, his blood pressure will be unrecordable. So it is important that blood should flow through the artery. So this is a complete definition of the blood pressure and you should write this in your examinations. So arterial blood pressure is expressed in four different terms: systolic blood pressure, diastolic blood pressure, pulse pressure and mean arterial blood pressure. So we will see them one by one. Let's start. Systolic blood pressure is defined as maximum pressure exerted in the arteries during the systole of the heart. So normal systolic pressure is 120 mm of Hg, that is 110 to 140 mm of Hg is a range. So what is this? When the systole is there, that means heart is contracted, that time maximum pressure exerted into the arteries during systole. So it is a pressure during contraction of the heart. So when heart is contracting and it is pumping out the blood, that time what is the pressure in the artery? That is called as a systolic blood pressure. Now we will see the diastolic blood pressure. So diastolic blood pressure is defined as a minimum pressure exerted in the arteries during diastole of the heart. So normal diastolic blood pressure is 80 mm of Hg, that is 60 to 80 mm of Hg is a range. So it is minimum pressure exerted in the artery during diastole. So when the heart is relaxed, that time in the arteries what is the pressure? So it is a minimum pressure in the artery when the heart is at the relaxed stage. So this is diastolic blood pressure. Now we will see the pulse pressure. So pulse pressure is a difference between the systolic pressure and diastolic pressure. So normal pulse pressure is 40 mm of Hg. So 120 minus 80 is 40. That means normal blood pressure is 120 by 80. So pulse pressure is 40. So we will see now the mean arterial blood pressure. So mean arterial blood pressure is the average pressure existing in the arteries. So MAP is equal to diastolic blood pressure plus systolic minus diastolic divided by 3. So if you see, my diastolic blood pressure is 80 and systolic blood pressure is 120 minus diastolic blood pressure is 80, that means 40. So diastolic is 80, 40 divided by 3. So it will come around 13. So MAP is around 93 to 94 mm of Hg in a normal circumstances. Okay. Now let's see the variations in the blood pressure. So age, arterial blood pressure increases as age advances. In the neonates it is low, in the older adults it goes high and high. Okay. Sex, in female up to the menopause arterial pressure is 5 mm of Hg less than males at the same age, but after menopause pressure in females become equal to that of males of same age. So till menopause means till around age of 45 to 50, the blood pressure in the females is less than 5 mm of Hg of the same age of male, but After the menopause, the pressure become equal in the male in the female. Okay. Body build. Pressure is more in obese person than lean person. Why? Because there is an increased demand of the blood to the peripheral tissue because of the obesity. So there is an increase in the cardiac output and there is an increase in the blood pressure. Diurnal variation. In early morning, the pressure is low and generally increases and reaches the maximum at the noon and become low in the evening. So this is normal diurnal variation. After meals, arterial blood pressure is increased for few hours after meals due to increase in the cardiac output. During sleep, usually the pressure is reduced up to 15 to 20 mm of Hg during the sleep. So during the sleep the body is relaxed. So that time the blood pressure is decreased. Emotional condition. During excitement or anxiety, the blood pressure is increased due to the release of adrenaline. So when you are too much excited or when you are anxious, that time adrenal gland will secrete the hormone adrenaline. So because of that vasoconstriction will happen, also heart rate will increase, and because of that there is an increase in the blood pressure. After exercise pressure increases above the basal level due to increase in the rate and force of contraction and also the stroke volume. So when you do exercise, there is an increased demand of the blood by the peripheral muscles. So to fulfill that increased demand, the heart will pump out more and more blood, and that will result into the increase in the blood pressure. So now let's see the determinants of arterial blood pressure, that is factors maintaining the arterial blood pressure. Means which are the factors that are maintaining the blood pressure to the around the normal level. So let's see them one by one. So some factors are necessary to maintain normal blood pressure. These factors are called as local factor, mechanical factors or determinants of the blood pressure. So let's see them. So what are the local factors? So local factors are divided into two types. Central factors, which are pertaining to the heart. In central factor means heart is at the center of the body and at the center of the cardiovascular system. So factors which are related to the heart are central factors, and factors which are pertaining to the blood and blood vessels means factors which are related to the blood or the peripheral blood vessels, those are called as the peripheral factors. So we will see one by one. So central factor, cardiac output. So systolic pressure is directly proportional to the cardiac output. When there is a more cardiac output, there is a more systolic pressure. So whenever the cardiac output increase, the systolic pressure is increased, and when cardiac output is less, the systolic pressure is reduced. Why? Because in the definition of the systolic blood pressure in early starting of this lecture, we have seen that systolic blood pressure is pressure in the artery during the systole of the heart. So when there is a systolic pressure is increased, the cardiac output is less. So when there is a less, there is a systolic pressure is reduced. Okay. So let's see next. This is heart rate. So moderate changes in heart rate do not affect the arterial blood pressure much. However, marked alteration in the heart rate affect the blood pressure by altering cardiac output. When there is a heart rate is very fast, that time what happens is heart chambers are not getting filled properly. So there will be decrease in the cardiac output. And when there is a very less heart rate, that time what happen? Heart is beating very less times in the minute. So there is a decrease in the minute volume and there will be decrease in the cardiac output and there will be decrease in the arterial blood pressure. Okay. So what are the peripheral factors? Those are peripheral resistance. Peripheral resistance is an important factor which maintains the diastolic pressure. Diastolic pressure is directly proportional to the peripheral resistance. Means as you increase the peripheral resistance, the diastolic pressure will also increase, and as you decrease the peripheral resistance, the diastolic pressure will also decrease. So when peripheral resistance increases, diastolic pressure is increased, and when it decreases, diastolic pressure is decreased. So let's see now blood volume. Blood pressure is directly proportional to the blood volume. If the blood volume increase, there is an increase in the venous return and cardiac output, resulting in elevation of the blood pressure. Obvious, when there is a more blood into the body, it will more and more blood will be given to the heart back as a venous return, and more blood will be pumped out, and that will cause increase in the blood pressure. Venous return, blood pressure is directly proportional to the venous return. When venous return increases, there is an increase in the ventricular filling and cardiac output, resulting in elevation of the arterial blood pressure. So obvious, when the venous return is more cardiac output, more blood pressure. Simple. Elasticity of the blood pressure. Blood pressure is inversely proportional to the elasticity of the vessels. Due to elastic property, the blood vessels are distensible and are able to maintain the pressure. When the elastic property is lost, the blood vessel become rigid, that is called as the arteriosclerosis, and pressure increases in the old age. Usually this phenomena happen in the old age. The blood vessels getting hard, so that the elasticity of them will be gone and they will be hard, so that heart need to work up more to flow the blood through those hardened blood vessel, and there will be increase in the blood pressure. So it is inversely proportional. That means more elastic the blood vessel, less will be the more elastic the blood vessel, less will be the blood pressure, and more hard the blood vessel, there will be more high the blood pressure. Okay. So let's see the velocity of the blood flow. Pressure in a blood vessel is directly proportional to the velocity of the blood flow. The velocity of the blood flow increases, the resistance is increased, so pressure is increased. So when the velocity of the blood flow increases, the peripheral resistance is also increased, so the pressure is also increased. So pressure of the blood vessel is directly proportional to the velocity. Means if the blood is flowing very slow, then there will be low pressure, and when the blood is flowing very fast, there will be more pressure. Even a simple water tap you can consider. When the water flows very with very high velocity, it will give more pressure, and when water flows very slowly, it will give less pressure. So high flow, high velocity, high pressure, low velocity, low pressure. Next is the diameter of the blood vessel. So arterial blood pressure is inversely proportional to the diameter of the blood vessel. So as the diameter increases, the peripheral resistance increases, so leading to increase in the blood pressure. When there is a decrease in the diameter, means the artery is getting small and small, the resistance will increase and there will be more peripheral resistance and leading to increase in the blood pressure. So it is inversely proportional. Next is the viscosity of the blood. Arterial blood pressure is directly proportional to the viscosity of the blood. So when viscosity of the blood increases, the frictional resistance is increased and this increases the pressure. Now viscosity means thickness. So when blood is getting thick, so it is hard to flow through the artery, and any thick substance you will allow to flow through the artery, that will increase the friction. So because of the friction, there is an increase in the blood pressure. So when the blood will get thick, there will be blood pressure will be more. So it is directly proportional to the viscosity of the blood. Okay. So next we will see the very important, that is regulation of the arterial blood pressure by the various mechanism. So we are going to mainly see the nervous mechanism and the renal mechanism. Hormonal mechanism and local mechanism are not that important, so we will mainly covering these two. So nervous mechanism is by the vasomotor center and impulse from periphery, and the renal mechanism is from the regulating of the extracellular volume and renin-angiotensin mechanism. So we will see these two one by one. So this first one is the barroreceptor mechanism. So what happens here? The barroreceptors are the receptors, specialized receptor, which are pressure sensitive, which are situated into the arch of the aorta and the carotid sinus, means near the carotid artery they are situated, and in the arch of the aorta. So when there is an increase in the blood pressure, the receptors will get stimulated and they will send impulses via cranial nerve 9th and 10th to the brain. So they will send impulses to the nucleus of tractus solitarius. So tractus solitarius is a nucleus which is, it is an area which control the blood pressure. So there is a inhibition of the vasoconstriction area. So there is a decrease in the vasomotor tone. So vasoconstriction area is responsible for the vasoconstriction of the arteries. So there will be decrease in the vasomotor tone, and there will be dilatation of the blood vessel. Because of that, the blood pressure will get reduced from the increased blood pressure and it will come to the normal range. At the same time, there is a stimulation of the vasodilator area, means there is an area in the brain which is responsible for the vasodilatation. So there will be increase in the vagal tone, and because of that there will be increase in the bradycardia and reduction of cardiac output. So heart rate will get slow and there will be decreased cardiac output, and ultimately blood pressure will decrease and come to the normal blood pressure. So this is very important to remember all this mechanism, because it is frequently asked question in the exam and also in the vivas. So let's now see again, very important is a renal mechanism of regulation blood pressure. This is long term mechanism. If you will see this is short term mechanism. Like if your blood pressure is persistently high, this mechanism will adapt with that blood pressure and will stop decreasing the blood pressure and it will deactivated. But long term mechanism, we will see how it act. It is mainly act by the regulation of the extracellular volume and through the renin-angiotensin mechanism. So we will see what are those. So when the blood pressure is increased, kidney excrete large amount of water and salt. Because of diuresis and natriuresis, there is a decrease in the extracellular functional volume and blood volume, which in turn brings the arterial blood pressure back to the normal level. So now my blood pressure is increased. So what my kidneys will do? They will throw more and more water and sodium out of my body. So because of that, what will happen? My blood volume get decrease, and we have seen in our determinants of the blood pressure that if a blood volume is decreased, there will be decrease in the cardiac output and there will be ultimately decrease in the arterial blood pressure. So let's see how it works. So there is a decrease in the blood pressure. So what will happen is, so in the renin-angiotensin mechanism, what will happen is, when there is a decrease in the blood pressure, what will happen? There will be stimulation in the juxtaglomerular apparatus. It is a one body into the renal nephron. So that nephron will secrete the renin. So renin will activate angiotensinogen into the angiotensin 1, and angiotensin converting enzyme will activate angiotensin 1 to the angiotensin 2, and angiotensinase will convert angiotensin 2 to the angiotensin 3 and angiotensin 4, and these two are potent vasoconstrictors, means their work is to constrict the vessels. So how it is happen, we will see once again. First, the renin is secreted by the kidneys, then angiotensinogen will convert it with the help of the renin to the angiotensin 1. Now this angiotensin converting enzyme will convert angiotensin 1 to the angiotensin 2, and angiotensinase will convert angiotensin 2 to the 3 and 4. These all are the potent vasoconstrictor, and also it will stimulate the adrenal cortex. So what adrenal cortex will do? Adrenal cortex will secrete the aldosterone. So aldosterone is a hormone which is responsible for the water retention. So aldosterone will act on the kidneys and there will be more reabsorption of the water and sodium. So if the water is absorbed into the body and sodium is absorbed into the body, what will happen? There is an increase in the extracellular functional volume and there will be increase in the blood volume. When the blood volume is increased, ultimately cardiac output is increased and the blood pressure will also increase. And here vasoconstriction is there, because of that again blood pressure will increase. So this is a normal phenomena when the blood pressure is decreased. But many times what happen? There is a pathology in this whole mechanism and this mechanism get activated without any need. So that time person will land up with the high blood pressure. Okay. So this is the renin-angiotensin mechanism. I hope this class is clear to you. So if you want more videos like this, subscribe to our channel and hit that bell icon so that you will get notifications about our videos. And also don't forget to give your feedback in the comment section so that we can get improved if any deficiencies are there in us. Thank you.